Hello everyone, it's Dr. Nikki, the board certified family nurse practitioner back in the house. I hope you're all well and you're staying safe. In today's podcast episode, I will be talking about psoriasis and eczema. Psoriasis and eczema. They are two common skin conditions. Alright, so we will be talking about the differences between the two conditions today because a lot of people get confused. They mix them up. So we'll talk about eczema and then I'll tell you the differences between the two of them. Alright, so let's start. Eczema. So as I mentioned before, but eczema and psoriasis, they're two common skin conditions, and eczema is also known as atopic dermatitis. Atopic dermatitis. Alright, I just wanted to point out first and foremost that they're both not contagious. You cannot catch it from other people. You cannot catch eczema from another person, and you cannot spread eczema to another person. But definitely you can. The eczema can spread, on your own body. Like if you have eczema, you can have it in different spots on your own skin, but you cannot spread it to other people. The same thing as psoriasis. It's not contagious. You cannot pass it on to somebody else. All right. And so like if somebody touches you, they won't catch psoriasis from you and they won't catch eczema from you. There is a family history tendency though. So if you have a family, somebody in your family that has eczema or psoriasis, you are at increased risk of having it as well. All right, but we've seen some people that do not have any family history and they end up having it. So but it increases your risk of having eczema or psoriasis if you have a family history of it. All right, so let us just get started. Eczema. So as I said before, eczema is also known as atopic dermatitis, and you will see a lot of dryness, a lot of itching, scaly skin, red skin. All right, and it can affect infants, children, adults. All right, a lot of children have eczema, some adults have eczema. You don't have to have eczema as a child to have it as an adult. All right, it's common in families, as I said before, and you definitely need to know the treatment options out there for eczema. All right, so eczema, the way that you would know that you have eczema, or if you're confused of what you have. So for example, if you have a rash that is scaly, is red and itchy and dry, and you want to know, what kind of rash is this, or you want to have an idea how you would be able to differentiate between eczema and psoriasis, is that eczema affects the flexor surfaces. All right, so flexor, I'll explain what that is. The flexor surfaces are where you bend or fold. All right, when you bend or fold. So if you behind your knees, when you bend behind your knees, all right, and then your elbow, all right, so the inside of your elbow, all right, and then behind your knees, you would see eczema in flexor surfaces. All right, on the other hand, psoriasis will be on extensor surfaces. Extensor means where you extend your elbow, all right, like right there at the back, and then it will be on the opposite side. And the same thing with your knee. When you extend your knee, it will be right there in the front. So extensor is where you extend and flexor is where you fold, or pretty much when you fold. Okay, and those are the classic differences that you would observe if you're trying to figure out what type of rash you have. All right, if it's eczema, psoriasis. So eczema, flexor surfaces, and psoriasis will be on extensor surfaces. Some people have eczema in other places as well, not necessarily only on the back of their knee or the elbows. They can have it elsewhere. The same thing with psoriasis. I've seen a lot of people that have psoriasis in their scalp. All right, the neck area, the scalp area, and it causes a lot of itching. It's inflamed. A lot of inflammation goes on with both conditions, actually. A lot of inflammation, because pretty much they are saying that both conditions are caused by overactive immune system response. Okay, so overactive immune system. So yes, a lot of itching, a lot of scales. All right, and that's a classic one for psoriasis. It's a silvery scaly patches, plaques. We call them plaques. All right, so as I said before, eczema can affect children, infants, adults, and you may not even have eczema as a child and end up having eczema as an adult. Psoriasis will most likely affect adults. Okay, All right, but we see psoriasis too starting in children, but most likely you will see psoriasis in adults. All right, so as I said before, treatment options are out there. There's actually, like, you can't say you cured eczema. There are a lot of treatment options to prevent flare-ups. All right, so treatment options, and eczema comes and go. So some people will be like, wow, I had eczema as a child and it's gone, or I had eczema some years ago and it's gone. It comes and goes, unlike psoriasis. All right, so eczema can come and go. Treatment options include moisturizers. All right, moisturizers and prescription medication. So we have ointments, topical. Topical is anything you rub on your skin. So we have, as I said before, we have topicals and we have moisturizers. So we have ointments, gels, creams, and all that. And the best way to know what type of rash or skin condition that you have is to see a dermatologist. Yes, a skin specialist. They will be able to diagnose you appropriately and also guide you in terms of your treatment options. They will explain all the treatment options out there and work together with you. I do not want you to self-diagnose yourself. I do not want you to self-treat yourself. All right, you need that professional consultation. So consult with a dermatologist or consult with your primary care provider for a professional diagnosis and treatment plan. Okay, so as I said before, if you have any kind of rash, red, itchy, patchy, inflamed skin, small bumps, typical of eczema. And as I said, it may occur in infants, children, and adults. A lot of itching, some sort of scratching going on. Itching may be more intense at nighttime, more noticeable and intense at nighttime. All right, so watch for inflamed skin, scaly skin, crusting and weeping. Very common in eczema, crusting and weeping. All right, very common in eczema. Okay. And as I said, so watch for eczema. Some people have it at the back of their neck as well, just like psoriasis. The elbow creases, as I mentioned before, so it's on the flexor surfaces where you fold or you bend your knee and your elbows and the back of the knees. All right. Okay, so other findings in people with eczema include, as I mentioned before, dry scaly skin, darkening of the skin, increased skin creasing on the palms or extra fold of skin. Some people have it, around the eyes, on their face. Some people have it on their legs and, behind their knees. The elbow area. So yes, those are the things that you would observe with eczema. All right, there's actually no specific test to diagnose eczema. As I said, it's based on medical history, it's based on symptoms and physical examination. So that is why it's very, very important for you to go and seek, consult with a dermatologist or your primary care provider. It's based on your symptoms, it's based on a physical examination, and it's based on your medical history. There's really no test. They can't do a blood test and say, hey, you have eczema. It doesn't work that way. All right, so it's a chronic condition. Eczema is a chronic condition. You can improve your life, by treating yourself well and reduce the amount of flares that you get. Okay, so the plan is to treat it so that it improves your life and you reduce the flares that you get. All right, so a lot of people with allergens do experience eczema or do have eczema. So when you have allergens, so you may end up having eczema as well. If you have asthma, it increases your risk of having eczema, allergens. So that is why they always say, please watch out for triggers. Watch for triggers and avoid triggers. All right, some people they have triggers may include sweating, cold or dry environments, emotional stress. Some people, when they're stressed, they break out, So emotional stress, anxiety, rapid temperature changes, exposure to chemicals, soap, detergents, perfumes, allergens, dust, cat, dogs, anything, even if it dust, sand, cigarette smoke, allergens pretty much can make, there are possible triggers of eczema. All right, so remember that I mentioned before that moisturizing your skin is very important when you have eczema, and the same thing with psoriasis as well. We'll get into psoriasis in a little bit. So moisturizing your skin is very important. It prevents it from drying out. Definitely you want to do that when you have eczema, because yes, you really want to moisturize that skin. And pretty much the moisturizing creams that a lot of people use are Eucerin, Cetaphil, Neutroderm. All right, so those are the common ones, Cetaphil, Eucerin, and Neutroderm. And then we have ointments like petroleum jelly. Good old petroleum jelly will do the wonders. All right, Aquaphor is very good. Vaseline is very good. They're very, very effective as moisturizers, okay? And because they have little water content in them. So moisturize, okay? And then I've seen a lot of people bathing with oatmeal. All right, so you can bathe with oatmeal as well. Just suits the skin, reduce the itching, helps you. All right, so you can do that as well. It keeps your skin hydrated. Lukewarm baths or showers can hydrate and cool your skin and relieve the temporarily relieve the itching from eczema. So yes, you want to bathe. All right, you should not do prolonged long baths. Like, don't do hot or long baths that it could dry out your skin. You don't want to do that. All right, and then we have other treatment options like topical steroids, like corticosteroids, hydrocortisone. You can get over-the-counter hydrocortisone, but it has a lower percentage, which is a lower concentration. You can get a 1%, I believe, over the counter. And then if you want a stronger concentration, a stronger percentage, you have to ask a doctor for a prescription for that. All right, so hydrocortisone is a very common one that a lot of people use for eczema. All right, stronger versions require a prescription, and you want to make sure that you don't keep on using hydrocortisone all the time, because it may thin out your skin and change the color, the color of your skin. So I've seen a lot of people that kind of mix it up, they put the hydrocortisone and they mix it up with a moisturizer like Eucerin or Aquaphor, and they use it that way so that it's not as potent and cause damage to your skin. All right, personally, I had an infant, that had eczema as a child, and that was what I did. I did a mixture of Eucerin and hydrocortisone, and it worked wonders. All right, so we have topical steroids, as I mentioned, corticosteroids, hydrocortisone 1% cream is without a prescription, and you can get a stronger version or stronger percentage through your primary care provider or dermatologist if needed. And then we have oral steroids as well. Oral steroids, those are the medications that you take by mouth, such as prednisone. They're used occasionally, not long term. They're used occasionally to treat flares. So if you have a flare up of eczema, they might give you steroids to help to relieve the inflammation. Remember that I mentioned that these skin conditions, they cause a lot of inflammation. So steroids tend to help with the inflammation. Severe flares of eczema, you want to treat it with steroids temporarily, occasionally, not long term, and it helps a lot. All right, so we have injectable medications as well. So some people use injectable medications as well. Some people use immunosuppressive drugs for eczema as well. And then if you have allergens, to relieve itching as well, you might want to use antihistamines. So oral antihistamines, it helps to relieve the itching of eczema. Over the counter antihistamines, we have Benadryl, good old Benadryl. is out there. Hydroxyzine is also out there, which is brand names are Atarax. All right, and then just be very careful because you may end up having some side effects from this medication, such as drowsiness, and so they say that you should be very, very careful because Benadryl and other medications, they may cause some side effects, so be very careful with the use of these medications. All right, so I'm happy that we did that about eczema. Now we are going to go into psoriasis. Yes, let us talk about psoriasis now. So psoriasis, as I said before, you can find psoriasis, which is also a very common skin condition, on the extensor surfaces. All right, so it will be the opposite side. Okay, so it will be the opposite side, and for psoriasis, you have well-defined plaques. Yes, well-defined. The scales are thicker, silvery scaly patches. They kind of stack up on top of each other, and they're extremely red. Yes, the redness is classic. Redness, silvery scaly patches, and they occasionally crack or bleed. All right, unlike eczema. All right, so eczema has more cracking and weeping. So as I said, it's on the extensor surfaces, and yes, the scales are thicker and they turn very red. All right, erythema is present, and that is where the steroids come in to relieve that inflammation sometimes when people have inflammation. All right, so how do you treat it? As I said, the same thing. You use topical medications, oral medications. They can prescribe you injectables as well, and yeah, that's how you treat psoriasis. Yes, you treat psoriasis like that, and as I said before, you can actually have psoriasis at the back of your neck as well. You can have it at the back of your neck. You can have it, and it causes a lot of flaking. Yes, a lot of flaking. You have psoriasis at the back of your neck, and it causes, your scalp area. It can cause a lot of flaking, and when you comb your hair, you see the flakes come off. All right, and it's really a lot of people are, ashamed of that when they try to cover their hair, their head. They don't want to show anybody, because it's kind of like they want to keep it to themselves. But when you lift their hairs up, you will see like some people have psoriasis, the rash at the back of their ears, at the back of the neck. And that's where you see psoriasis if they have it there. And as I said before, your knees, your elbows, even the butt crack as well. Some people have psoriasis there, the butt crack, and you see that classic silvery scaly patches. Okay, and so as I said before, scalp psoriasis is a very, very common skin disorder. It's red, it's raised, it has scaly patches. It can pop up as a single patch or multiple patches stacked up on each other. The scales are very thick, as opposed to the one for eczema. All right, so treatment options, as I said, the same thing. You want to moisturize, have lotions, oils, creams. You want to have different things: foams, ointments, soaps, gel, lotions, shampoo if you have medicated shampoo, if you have scalp psoriasis. All right, and then but as I said before, you can get some products over the counter, but they don't have that strength. All right, if you need medication that are stronger, you will need a prescription for those. All right, so you have to talk to your dermatologist or your skin specialist, and some of them may actually do a biopsy as well. All right, because sometimes you may need a biopsy to be done to rule out other similar skin conditions like seborrheic dermatitis. So you want to make sure that you definitely do not self-diagnose or self-treat yourself, and consult with your primary care provider or a specialist to be able to accurately diagnose you and treat you. All right, so just remember that psoriasis and eczema, they are not contagious. You cannot catch it from people. People cannot give it to you. All right, so when you do start scratching away, you may end up with infections like bacterial infections, and they may have to prescribe you antibiotics for those. So please try, I know it's hard, but try not to scratch too much, okay? And then, yeah, as I said before, there are topical steroids out there. The 1%, I believe, is over the counter. If you want a stronger concentration, like 2.5%, then you have to get a prescription for those. Okay, and psoriasis is a chronic condition as well. And yeah, just corticosteroids, take medications, and it helps. Some medications have adverse reactions, serious side effects, which include liver damage. So you would have to be under a doctor's monitoring. All right, you have to be under a doctor's monitoring for those, because of the serious side effects that they have. All right, so there's no cure as well. There's no cure, but treatment options are available for you to control flare-ups, as I mentioned, just for eczema as well. It prevents from coming back. There's no cure, but treatment options are out there for you. Plus, so please do not suffer in silence. Seek help. Consult with your doctor, consult with a dermatologist. There are many medications out there that has helped a lot of people, and you may have to try more than one medication to help you. But yeah, there are medications out there. It has worked for a lot of people. Consult with your doctor, consult with your dermatologist. Psoriasis can be very, very can be a devastating diagnosis for some people. So please watch out for that. So let's recap. Psoriasis, you will find that mostly on the extensor surfaces. Extensor surfaces meaning where you extend your joints, so like your elbow and your knees. And then for eczema, it's on the flexor. Flexor means where you bend or fold. So behind your knees, your elbow, like right in the front, where you bend your elbow, and it could be elsewhere as well. And you see eczema in children, infants, and adults, and you see eczema, psoriasis, pretty much mostly in adults, mid-age. Some children do start having it as well. But eczema, some people develop eczema as adults and they do not have eczema. They did not have eczema as children. And there's a family history tendency too. So if you have a family history of eczema or psoriasis, you're at increased risk of having the condition as well. All right, I hope this helps. And I hope you would share this episode with friends and family that have skin conditions, or they need kind of education, and see what could be done about their skin conditions. All right, thank you so much for tuning in today, and I hope to catch you in the next one. Take care. Bye-bye.